This is a pretty short chapter, and it's pretty straight to the point. It's about substance-related and addictive disorders, and they have some great information in here, some tables, as well as some different things about policies and um, uh, signs and symptoms of withdrawals and opiate intoxication, because you will come across that with your patients, whether you're in an ER, mental health, or even up on the floor or out in public. When people are doing some type of substance or opioids, it does affect some of the same areas of the brain as we see in other mental health disorders. It can actually trigger certain neurons and neurotransmitters within the brain. When someone is having this type of addiction, whatever addiction it is, it's usually not a disorder of choice, something that they choose to do. Sometimes there's actually even believe a gene or whatever's being triggered in the brain leads someone to this, and once they're introduced to this substance, it becomes an addiction, something they can't stop. When it comes to substance abuse, usually it's reoccurrent. It actually will result in the inability to manage work, home, school, and also it can affect other situations such as driving. It's usually over a 12-month period, and they usually and most often deny that they have a problem. When it comes to substance dependence, again, this is also over a month period. They have actually no control over this addiction. They continue to use. They're looking for it despite any consequences, and they will lie, steal, cheat, whatever they have to be able to get to whatever this addictive substance is. They also build a tolerance with this dependence, and so they're looking for that next high that it gives them, and so they keep searching for it because nothing beats that first high off this substance. So they go and they're seeking and they're seeking and they're seeking, trying to find it, and they become addicted. And with this built-up tolerance, they just be able to take more and more. I do have a video for you on the PowerPoint presentation that I give you to write notes on, and it is about a physician who was taking over 100 different pills a day, and most people that would kill, but he had built up such a tolerance in how he was continuously looking for that high and that need, and he was taking all of these pills. So please be sure to look at that YouTube video. Like I said, it is on the other PowerPoint presentation. When it comes to addiction, lots of times you're individuals who are using drugs. So what we find is sometimes another problem with addiction is sometimes you'll have individuals who are getting for that high, and then later on they realize they need to sleep, and then they start taking what we call those downers. So, and then they become very dependent. If anybody remembers Elvis Presley, that was one of his issues, is that he would be taking uppers and downers all the time because he was get too high, and then it was time to sleep, and he was tired, and he wanted to sleep, but he couldn't sleep, and then he would take the downers, and then going back and forth, and also that becomes that addiction, and they can't get away from that drug. This is when they start to have some type of loss of control due to this dependency. It starts to take over their life. They have no control over what their body does because now they're depending on that drug to guide them, whether they need to rest, to sleep, or to have the energy to go on for the rest of the day. And sometimes they participate in the dependency despite any other problems. It becomes their focus no matter what. And unfortunately, when people get out of this, it's so very easy for them to relapse back into a dependency. You'll see also individuals who have been addicted to drugs who've gone through rehab, and they may have a procedure done, and they're afraid to take their medication for pain for fear that they're going to fall back into this dependency and addiction. Here's a list of substances that can lead to use disorders, and the opioids especially, we'll see this with even professionals and healthcare professionals when they've had some kind of procedure and they've been taking something for pain and they become addicted to this. We know tobacco, those who are smokers say is such an addiction and it's something that they have trouble getting away from. And then we also have other addictions too, besides any type of substance, and this could be like social media. Yeah, that is an addiction. Gambling, shopping addictions, people who spend and they just shop and shop and shop and shop and they just can't help themselves. My son keeps telling me he has that problem when he goes out. He has to buy something every time we go somewhere, and he says he thinks he has an addiction. But so here's a few of these different ones, and so please look through your textbook, and they actually go through some of these medications. The cannabis is actually another way for like hashish or marijuana. You have your opioids. This is your heroin and opium, and as we know, heroin has become a huge, huge problem here in the United States. Here's some basic concepts that will also help you with addictive use disorders. One of those is addiction, and this is, addiction is actually what we call a primary chronic disease of the brain, reward, motivation, memory, and related circuitry. So it is something that the brain seeks, and it's a reward system. When they have this drug that they've been seeking and they get it, it's like, yeah, it's kind of like you've been craving that one, let's say, chocolate cheesecake from the Cheesecake Factory, and then when you finally get it, it's like, oh my gosh, that pleasure that comes across completely. But these individuals usually include some type of loss of behavioral control with the craving and the inability to abstain. They have a loss of emotional regulation, loss of ability to identify with problem behaviors and relationships due to this addiction. They're just, it overwhelms them. Intoxication, as we know, it is, when they have had excess of whatever type of substance that they have been seeking. And so, again, this can affect them whether they're under the influence. And so sometimes you may hear that term, someone's under the influence or they're intoxicated, meaning that they have excess of whatever it is that they've taken. Tolerance, again, is that their need is increasing because the amounts that they're taking are no more reaching that desired level, and so they need more to get to that level. And then withdrawal, this is a lot of physiological symptoms that we'll see when individuals go through withdrawals, and the body doesn't know how to handle not taking this drug or having this substance in their body, and so they will go through these withdrawals, which can actually be very dangerous, and many people need to be watched as they're going through the withdrawal symptoms. These are some of our populations at risk, and of course teenagers, they're curious. What is this? What does it do? Or is peer pressure? Well, everybody's doing it. They're doing it. Well, it must be okay. Your psychiatric patients trying to get over whatever psychiatric disorder they may have. And so sometimes they're treating themselves, or they don't like their medication that they're prescribed, and so they try to treat themselves with these substances. Women, we're seeing more and more because of the pressure on women trying to be super mom, trying to work full time and be super mom, taking care of the household and the kids. A lot of single moms out there as well. Your hospital clients who have been given medications and now all of a sudden become addicted to something they were taking for an ailment. Older adults, the polypharmacy, they're taking too much and they don't realize it, or they're being overdosed and not realizing they're being overdosed. Adult children of alcoholics, again, this is usually something that they have mimicked, they've seen, they saw this is how their parents dealt with issues and thought this was the norm, and so it's not unusual to see this passed along. And then healthcare providers, the stress of healthcare, the go, the access, easy access, and and again, your video is really, really helpful when it talks about the healthcare providers, and we can talk more about this in class as well. If you want to read up about the epidemiology with alcohol and other substances, it's really, a lot of statistics, but it's really interesting information that they have. And it's on page 416 in your textbook. Some of the commonly abused drugs, they have a huge table, unfortunately, I guess really to say, and it starts on page 413, not 414, but page 413 all the way through 415, talking about some of these drugs, some of the street names for them, how they're taken, and then the effects and the health risks that go along with these. And they're really interesting. Some of these you may not even have known what they were, or maybe you've heard the street name and never even realized that that's what it was. I remember the other day I was sending something home to my son's girlfriend, and I said, here, you can just take this to school and give it to his little girlfriend. Well, it was it was a kit I had gotten. It was some bath salts, and I thought, well, I wouldn't really use these, but she likes things like that, and I thought, oh, wait a minute, I better not send that to school, because I remember reading about the bath salts that some of these kids were taking, and I just thought, oh, great, my son would be, brought in and arrested or something for bringing bath salts to school. So, and they do have some information about the bath salts on page 416 in your book, called under Health Policy. And so if you're interested about that, please go in and look at this. We have actually seen people go way off the deep end when it comes to the bath salts, and so it's very informative information. Some of your comorbidities, you have some common risk factors, and this is usually someone's had some type of major trauma, stress, or it could be their environment that can lead to an addiction. Maybe the environment where they live, where they've been brought up, what they're around the most. Trauma, we can even see this with individuals who have been to war and they come back, and they're using these drugs to help them get through a situation, or just through stress. Someone's stressed out, hey, I need to relax. They start drinking, the smoking, a little like drugs, and relax you, and then it becomes something more. Medical comorbidities, some of the things that we can see with this is the risk for hepatitis C, and if you look at that video that I suggested about the healthcare worker, it'd be very informative. Diabetes, cardiovascular disease, and of course HIV, which still has not gone anywhere, which a lot of people don't tend to talk about or think about as much as they used to, but it's still around. Looking at the etiology, again, neurobiological factors, you've got that dopamine and that reward system I had mentioned earlier, the psychological factors, and a lot of times people are trying to self-medicate themselves. Oh, I'm a little down right now, let me just give me something, pep me up, or vice versa. Some of your sociocultural factors, socioeconomics. Some actually start doing the drug, and then they start selling to help their habit, but also to make some money, people can start stealing. Like I said, they lie, steal, whatever they can to be able to get to that drug. Some of your socio-cultural theories, it's thought that there's certain cultures within the United States, such as your Native American groups, have a high percentage of members with alcohol dependence. Other cultures, such as your Asian groups, actually have a low percentage of alcohol dependence. So it's interesting when you look at some of the cultures and how and what substances they do rely on or do not rely on. Other factors such as gender bias, women usually are impaired faster than men because of the body makeup, and women seem to progress faster towards liver disease. For your older clients, they may have that history of alcohol abuse, maybe alcohol abuse in the family, or sometimes people believe there is an addictive gene. Some of the stressors can be, the loss of a spouse, retirement, or maybe just social isolation. When you're doing the assessment, you want to look at the family assessment. Is there any codependency going on, or enabling, including peers? And doing also, you want to think about your self-assessment. What are your feelings about this, about individuals who have this addiction or this disorder? It's a good thing to look back at. Some of the screenings that they have that are available are the Addiction Severity Index, the Recovery Attitude Treatment Evaluator, a drug abuse screen test, and then they have the CAGE aid, which is table 22.2 in your textbook, and it's looking at the day, the occasion, or by the week, and they have this a little graph here. If you'll look on page 419, and it talks about that. They also have the alcohol use disorder identification test. It's a little audit, a self-report that someone can fill out to see, do I really have a problem? So you do have some of the screenings, interventions, and some of the referrals for treatments. Sometimes people aren't sure if they do have a problem until they actually get assessed and realize, well, gosh, maybe I do have a problem. They also have interesting, I think, is looking at the family and the codependence and the enabling of the individual. And lots of times that's some of the biggest problems that we run into. Also, not only with healthcare professionals, we also have to look at the Virginia Board of Nursing. If a nurse is seen as intoxicated, that is, or has a substance abuse issue, that will be posted. And someone can definitely lose their license, and people's lives are at risk. So you definitely want to pay close attention to, yourself. Think if you're called in and you've been out partying or been out to a social event and you've had some drinks, you don't want to say, yeah, I'll come in, because you're short-staffed and you still have that substance in your body. I mentioned in the last screen about codependence and enabling, and codependence is having an over-responsible behavior, doing for someone what they could actually really do for themselves, and self-worth is in caring for others but not caring for yourself. When you have the enabling, this is allowing or supporting the behavior, making excuses for them. They're just going through a rough time right now. They'll be okay. And, oh, can I get you anything? And instead of letting them, hit bottom and actually go through some struggles. In your textbook, look on page 423. There's some interesting nursing diagnosis and some outcomes and some of the signs and symptoms that can go with these diagnoses that are very interesting. So please look around through those. In planning, again, you want to identify what is the problem, and let's set a goal, a realistic goal, along with the patient. And then look at the interventions in which you think that they can accomplish. You don't want to say, oh, they'll not take their drug for the next 3 weeks while at home, after you send them home. It's a struggle. We also need to pay attention to signs and symptoms of withdrawal for these individuals, because they're going through a lot. And so it's on page 421, some tables, but looking at some of the signs and symptoms of withdrawal, whether it's from an opiate or some other type of stimulant that you'll see. And again, some of these individuals really need to be monitored because of the heart, the stress that it puts on the heart, and the individual's blood pressure and so forth. So they go through a huge change and transition. So very, very important that they are monitored as they go through this withdrawal. They also have some of the signs and symptoms of withdrawal on page 421. It's at table 22.5, which is very helpful as well. As you can see here, once they go through the withdrawal and get clean, go through what we call the detoxifying, it doesn't stop there. So they have to go through the rehab. They may live in a halfway house for a while to see how they do getting out into society, or sometimes there's apartment buildings that many of them live and they work, but they're there for support and they go to a lot of outpatient meetings. Or they may have partial hospitalization. They have intensive outpatient treatments and then outpatient treatment. But it's a step-by-step process. It's not like what you see with the Hollywood figures. They go for 30 days and then they leave and then they're out and next thing you know they're in trouble again. That's not really how things work. It is a long process and it's a continuous process and it never stops. They always have this addiction or this problem, and the thing is not falling back. And if they do fall back, knowing that they can keep going forward and not to keep spiraling backwards. Some of the other parts of implementation can be your brief interventions. One of those is called frames, which looks at feedback about personal risk, encouraging personal responsibility, and providing advice to change a menu of treatment or self-help options using an empathetic communication style, and the result is self-efficacy or empowerment, knowing that they can do that. Counseling, preventing relapses is huge. Sometimes they may have some other pharmacological interventions that they may need, such as something like antabuse or methadone. The other thing too, we have to make sure they're staying up on their medications. They're at risk. They need to make sure they have their vaccinations. They're, as I said earlier, hepatitis, HIV is huge as well. Counseling, maybe finding other coping measures. Maybe that's it, or maybe they just tried it for the heck of it and all of a sudden they became addicted. So we need to find out what's going on. So a lot of health teaching and health promotion and finding where they can put their energies, and if they do feel like they're going to fall backward again, what can we do to help? Where can they go? Who can they turn to? They do have a list of some of those medications on 427 that can help patients with the treatment for their disorder. There's also a case study about alcohol use disorder, and it's really interesting to look at some of the processes that they go through, and those some page 426 through 427, and I think that would be very interesting. Sometimes we think we assume things about substance abuse and addictions, but it's important to look at some of these case studies and seeing how things are set up for these patients and what they actually go through. Again, here's another YouTube video that you can look at, and it's also on the other PowerPoint. Also, we have Al-Anon, Alateen, Nar-Anon, and Gamblers Anonymous are some of the other anonymous. We also have for the families and for children of parents who are alcoholics as well, but they need these support groups. For the Narcotics Anonymous, again, sometimes they need something a little more than just with the alcohol, but they're stuck on the narcotics, and so what can happen there. And then Gamblers Anonymous, I actually have a friend who is married and did not realize that her husband had a gambling addiction until they lost everything. Her marriage actually ended as well, but it was really sad because he couldn't stop the gambling, and they lost everything. So it hits really hard, and it is definitely a problem. All right, that's all I have, and then we'll do the rest of our discussion in class.